Hello everyone, this is Dr. J with the Human Movement Institute, where we have improvement through movement. Today we will be discussing tennis elbow and lateral epicondylagia pain relief. Tennis elbow is known to be one of the most common, if not the most common cause of lateral elbow pain. There are many different structures at the outside of the elbow that can lead to outer elbow pain. Thus, you should have an accurate human movement diagnosis to know what best to treat for your elbow pain. In today's video, we will be discussing the most common cause of lateral elbow pain when it comes to tendinopathy or lateral epicondylagia. The most common muscle and tendon found in the literature to be involved with lateral epicondylagia is known as extensor carpi radialis brevis. It starts over on the lateral elbow and comes down to the dorsal second wrist compartment. Anybody that's doing gripping with repetitive extension-like motions of the wrist and hands can lead to pain and inflammation on the lateral elbow. When the symptoms are acute, you can have true inflammation within the tendon. However, the newer literature shows through histological studies that there is sometimes an absence or often an absence of inflammatory cells in the tendon on the lateral elbow, especially if the symptoms have become chronic or long-lasting over extended periods of time. So what are a few ways to help decrease pain on the outer elbow? With the small self-care mobility tool, you can start to feel the musculature on the outer forearm. We know this collectively as the extensor wad. If you make a fist and extend your wrist and radial deviate your wrist, you can help find extensor carpi radialis brevis and longus. Once I find the muscle that's tender into the tendon that's tender, I can start with some self-care mobility. Many patients get drastic relief, at least in the short term, as we start to mobilize the extensor wad. We can be very specific where we're working the most common muscle and tendon, extensor carpi radialis brevis, but we can also work the third slip of the extensor digitorum musculature. Long and short of it, don't leave any tissue on the table, meaning that if there's any restrictions or tightness or tender spots in the outer forearm musculature, we can start to roll the tissues and the muscles out. We can tack, twist. We can tack, twist, shear with muscle or across muscle. Spend a starting dose would be anywhere from 2 to 5 minutes, a couple days a week, to help modulate or manage any outer elbow pain. We can progress the mobilization by contracting the muscle with contract, relax, and then mobilize the lateral elbow musculature. Search for the tender tight spot, spend a few minutes mobilizing it, and as soon as you're done with mobilization, I would highly recommend doing some active range of motion. 10 to 20 reps clockwise, 10 to 20 reps counterclockwise. This would be a short-term pain relief video for patients with lateral elbow pain. If you've liked this video, please hit the like button, the subscribe button, and please share it with your friends, family, colleagues. Take care, and I'll see you all again soon. Bye-bye.